One of the most common questions I get is, will my disc herniation heal on its own? If you've been told you have a herniated disc at L4, L5, or L5-S1 and you're confused, scared, or just want a straight answer, you're in the right place. In this video, I'll explain whether a herniated disc can truly heal on its own without surgery, without therapy or treatment, and what most people get wrong about it. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada, with 35 years of clinical experience. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. I upload a new video every week. So yes, a herniated disc can sometimes heal on its own. The body does have a natural ability to shrink or reabsorb disc material over time, especially when the herniation is more severe, like an extrusion or what we call a sequestration. As that material shrinks and the pressure on the nerve decreases, pain and other symptoms actually can improve. But here's the caveat. Simply waiting for a disc to heal on its own may not be the best strategy. Why? Because it's unpredictable. Some people improve, but many don't. And while you're waiting, you could be stuck with months of pain, missing work, or losing quality of life. Even worse, leaving a nerve compressed for too long can actually increase the risk of permanent damage. So what does the research actually show? Well, they did what we call a meta-analysis of 34 studies. So scientists looked at 34 different studies involving more than 2,000 patients. They looked at people with lumbar disc herniations treated with non-operative conservative care. So these would be things like observation, rest, pain medication, different forms of therapy, but they did not have any surgery. They found that the chances of natural regression vary a lot depending on the type of herniation. So for a simple disc bulge, the chances of regression was actually only about 13%. For what we call a protrusion, it was around 41%. For an extrusion, about 70%. And for what we call a sequestration, so that's where the part of the disc is actually completely separated, the chance of regression was actually as high as 96%. That's all straight out of the Scientific Studies Journal of Clinical Rehabilitation. A more recent 2023 review confirmed the exact same numbers. Bulging discs regressed about 13% of the time, protrusions 52%, extrusions 70%, and again, sequestration is about 93%. That's the Journal of Neurosurgery. Why does this happen? Once disc material pushes out and it's exposed to the spinal canal, the body recognizes it as something foreign. It's a foreign invader. So the body actually sets off three powerful healing mechanisms. First, the immune system launches that inflammatory response around the disc fragment. Second, you're going to get new tiny blood vessels. That's called neovascularization, big fancy word, but they're going to grow into the area, bringing oxygen and nutrients. And third, macrophages, so those are the cleanup cells of the immune system, move in and begin to actually digest the disc material. Together, these processes gradually shrink and reabsorb that herniated fragment. Now, this doesn't require surgery, and in many cases doesn't even require aggressive therapy. It's something the body can actually do on its own. But what about the timeline? MRI studies show regression can happen anywhere from 3 to 12 months. On average, visible reabsorption takes place around 9 months. Sometimes symptoms improve earlier as inflammation calms down, while in other cases, the pain can actually linger even though the disc is shrinking on the scan. So this is what makes it so interesting. It sounds like I'm saying leave it alone. Absolutely not. But what it is they've done study after study after study on MRI, have actually shown people with significant disc herniations who have no pain whatsoever, and they've done study after study after study showing people who actually had no herniation whatsoever, yet had significant pain. So unfortunately, the answer is not as easy as we would like. But so here's the limit you need to know. Not all discs regress. Contained herniations like bulges and protrusions are actually far less likely to heal naturally. The most common disc herniation types we see in our patients, as confirmed by their MRI, are bulges and protrusions. And even when imaging shows improvement, symptoms may not fully resolve if the nerve has been irritated for too long. That's why waiting without intervention can prolong pain and disability, often let things get worse, and in some cases actually carry the risk of permanent nerve injury. Now, here's the reality I see in my practice. I've had hundreds of patients who thought their disc bulge or herniation would just heal on its own. They told me they waited 6 months, sometimes even 1 or 2 years, hoping the pain would disappear, or they were waiting for an MRI that long. But when they finally came into my office, they were still suffering, and it doesn't have to be like that. There is no good in waiting. Even though the body can sometimes reduce the inflammation and shrink the herniation, that doesn't mean the underlying cause has been fixed. In fact, in many cases, there are multiple contributing causes. like spinal misalignment, stenosis, degeneration, spondylolisthesis, that are never fully addressed when you wait. That's one of the biggest reasons healing is delayed, and one of the reasons the problem often comes back. And here's the truth: it doesn't get easier over time. It gets more complicated, the spine becomes more damaged, and the risk of eventually needing surgery increases. That's why it's always best to get a professional evaluation and the right treatment. In our clinic, we use a 7-step neurospinal restoration program. At the core of that system is a powerful treatment called non-surgical robotic laser spinal decompression. This treatment has been shown to help over 90% of patients recover from disc bulges and herniations without surgery. It combines robotic precision with laser therapy to relieve pressure on the disc, restore spinal mechanics, and stimulate healing at the source. We see consistent results because we don't just rely on just one treatment. Non-surgical robotic laser spinal decompression is combined with 6 additional steps that work together to reduce pain, improve function, and support long-term recovery. I go into the full breakdown of the 7-step neurospinal restoration program in other videos on this channel. I'll include links to those videos in the description below. For now, let's focus on what makes non-surgical robotic laser spinal decompression so effective. It combines 2 proven and research-backed treatments into one synchronized system. That's what makes it so unique. In fact, there are only 12 clinics in the world that have this robotic decompression and laser technology, and we are one of them right here in Ottawa, Ontario, Canada. The 2 treatments it combines are Class 4 cold laser therapy and spinal decompression therapy. Class 4 cold laser uses high-powered light energy to penetrate deep into the tissues around your spine. That light stimulates cellular repair, reduces inflammation, and improves circulation. All of these are critical for healing of the disc and for calming the nerve. It's like recharging the body's internal battery. It helps damaged or inflamed tissues repair faster and more efficiently, whereas spinal decompression is a therapy that is a gentle computer-guided decompression treatment that relieves pressure on spinal discs. In the case of a herniated or bulging disc, especially at L4-5 or L5-S1, decompression creates space between the vertebrae. This helps the disc move away from the nerve, it reduces compression, and it improves nutrient flow into the disc so that it can recover. Now imagine getting both of those treatments at the exact same time. I don't mean the same visit, I mean exact same time. While decompression is reducing pressure on the nerve and drawing fluid and nutrients back into the disc, the laser is calming inflammation and speeding up the repair process. It's also easing up the muscles so the body doesn't fight against the decompression. That's a big factor in a lot of standard spinal decompression, and why non-surgical robotic laser spinal decompression typically gives such better results. That combination creates a powerful healing effect, and it's the foundation of our neurospinal restoration program. This is how we get a success rate of over 90%. We've had patients who are already scheduled for surgery, fully expecting to go through with it, and they were able to cancel the surgery completely because of the results they got from this treatment. So let's circle right back to the question we started with. Can disc herniations heal on their own? Yes, sometimes they can, but if you choose to wait it out, you're taking a big chance, a chance that it may not heal fully or that it may come back again. Remember, the problem is that of all the chronic low back cases, 96% of the costs are due to chronic cases, and often by not treating something properly, you're letting it become chronic as well. So sometimes worse than before, and that you've got to decide, is that a risk worth taking? Here's what I recommend instead. Look for a doctor who's trained in spinal decompression, and if you can find a clinic that offers non-surgical robotic laser spinal decompression, that's obviously even better. If you're in the Ottawa, Ontario area, we'd be happy to help you here at our clinic. If you found value in the video, please like it and share it with someone who needs to hear this. Have a question or a comment, drop it below, and make sure to subscribe if you want more tips and strategies on how to relieve back and neck pain without drugs, without surgery. The next video you should watch is this one. It walks you through our 7-step non-surgical treatment method for L4-L5 disc bulges and herniations. Please go watch that video next.